You know, in medicine, some of the things we just assume to be true can actually be pretty dangerous. Today, we're going to tackle one of them, the connection between a super common symptom, a fever, and a rare but incredibly life-threatening emergency. I want you to think about this for a second. What if a symptom that you've probably had dozens of times, something as simple as a fever, could suddenly signal a catastrophic, life-threatening emergency? Well, in one very specific context, it does. And that's exactly what we're breaking down today. All right, first up, a misleading symptom. We're going to start with something we all know, something we've all experienced, the good old fever. Right? We all know what a fever feels like. It's your body's alarm system basically shouting, hey, I'm fighting something off in here. It's this universal signal for an infection or some kind of illness. But what we're about to see is that in one particular medical situation, it signals something way, way more urgent. Okay, section 2, the ectopic truth. This is the part where that common assumption we all have about fevers gets completely flipped on its head. So these are the textbook symptoms of an ectopic pregnancy. You've got sharp pain, usually on one side, some bleeding, sometimes even shoulder tip pain, which is from internal bleeding, and of course, dizziness. But take a really close look at that list. Notice anything missing? And there it is, the big reveal. Medical sources are absolutely crystal clear on this. An uncomplicated ectopic pregnancy does not typically come with a fever. This single fact right here is the most vital distinction you need to understand. It's the whole ballgame. So that brings us to section 3, fever as a fire alarm. If fever isn't a typical symptom, what on earth does it mean when it does show up? Well, you've got to think of it less like a symptom and more like a fire alarm, just screaming that a catastrophe is happening. This is the critical shift in thinking you have to make. When a fever appears in this context, it's not just a sign of a simple illness. No, it is a massive warning sign that a dire complication, like a rupture, has probably already happened. It elevates the entire situation to a top-tier, life-threatening emergency. So, why does the fever show up at all? Well, first off, a rupture. The fallopian tube bursts, causing internal bleeding. All that blood irritates the tissues inside the abdomen and triggers this massive inflammatory response, and that's what causes the fever. Or it could mean a nasty secondary infection has taken hold in all that damaged tissue. And finally, it could be a whole other issue happening at the same time, like a severe kidney infection, just creating an absolute perfect storm of problems. Okay, section 4, the emergency checklist. Because, understanding the why is one thing, but knowing when you have to act is, well, it's everything. This right here is the simple but incredibly powerful math of this situation. It's not the fever alone. It's the fever plus those classic ectopic symptoms like severe pain or bleeding or dizziness. When you combine those two factors, the result is always, always a life-threatening medical emergency that needs help right now. And just to be perfectly clear, this combination isn't a maybe or a could be. It is a massive, blaring red flag for a rupture, which means severe internal bleeding. This is truly one of the most time-critical emergencies you can face in medicine. Okay, let's step out of the textbook for a second and into the back of an ambulance. How does an EMT or a paramedic process this information when they get to the scene? Because honestly, their perspective really drives home just how serious this is. When a first responder sees this combination, fever, bad abdominal pain, and a positive pregnancy test, their mind immediately runs through a list of worst-case scenarios. A ruptured ectopic is right at the top, of course, but they're also thinking about other severe problems, like pelvic inflammatory disease or a major kidney infection. And since every single one of these possibilities is so serious, they just can't afford to waste a single second. So this is the bottom line for them. There is no wait and see. There is no delay. The patient is immediately treated as a time-critical emergency. The number one priority is getting to the hospital as fast as possible, all while constantly watching for signs of shock, which is the body shutting down from blood loss. All right, we're at our final section. If you take away nothing else from this explainer, please let it be this one single core principle. This is it, the single rule that summarizes everything we've just talked about. An ectopic pregnancy on its own rarely, if ever, causes a fever. So if a fever is present, you must assume the worst, rupture, a bad infection, or some other dangerous condition until it's proven otherwise. It's a simple distinction, but it completely reframes a common symptom into a critical warning sign. And knowing that difference, well, it could save a life.